If you suffer from chronic neck and back pain, you're probably looking for a lasting solution so you can get rid of the pain. Well, if you're looking for a treatment option that doesn't involve taking pain-killing drugs, injections, or surgery, our back and neck pain expert has an option for you to try. Dr. Christopher Miller from Total Health Chiropractic, the sponsor of this segment, is joining us along with one of his patients, Julie. Welcome to 8 West.
Thank you.
So, Dr. Miller, let's talk about it. What are the different kinds of problems that you really help to correct?
Well, Terry, we get a lot of people that do suffer with chronic neck or back pain, and this is an issue that's been, struggling and they've been dealing with for months or even years at times. And a lot of times it's not just that, but they can have radicular symptoms where these nerves travel. So if they have neck issues, sometimes it can go down the arm or in the hand and the lower back. It can be through the hip, the groin, down the leg, and in the feet or toes. And, it's frustrating enough to be dealing with the pain, but on top of that, they have a lot of frustration just with the time and effort it takes to get anywhere with these problems because, they may start with one doctor and sometimes they don't even have a diagnosis and they'll give a recommended treatment and they'll have to go through that for sometimes many, many months without really results before they can go to the next step. And, then they may have to find another doctor and it's months down the road. And all this time they're dealing with pain. So that is something that we pride ourselves in, that we structure our appointments in a way that people, when they call, they can get in usually within 48 hours. It's just one place they have to go to. We'll get the records or what we need to instead of them having to drive all over town and go to different facilities. So we can get a diagnosis and get them answers very quickly and make a decision if we can help them get their problem solved. And they can usually move ahead within a couple days with treatments.
And by the time people come to you, they're probably almost at the end of the rope thinking that they've tried everything except maybe surgery. So Julie, let's talk about you. You seem so young to have had a chronic neck and back pain issue.
Yeah, so it started when I was very young with a severe car accident and then dance injuries throughout the years, and 17 years as a kindergarten teacher reading books at a very weird angle to children that finally the bulging disc in my neck just kind of got to the point where I was in so much pain every day, at least a level 6 to 7 out of 10 on a regular basis.
Yeah, so you had pain, and you also were sharing with me that you had almost a paralysis, like you couldn't feel your arm.
Absolutely. So my thumb was completely numb, and my hand and wrist were in constant pain that, as an assistant principal, I could go and observe my teachers and couldn't even write notes to them anymore. I would have to type things. Handwritten notes were out. Golf, tennis, vacuuming, mowing the lawn, anything that required that push or pull was just null and void.
Even going on a walk with your girlfriend.
Yes, walking, you're trying to talk to your friend while you're walking. I couldn't have her stand on this side of me because my neck wouldn't turn this way. She'd have to stand on this side. And yeah, it was crazy. And I had done years of physical therapy, cortisone shots. Nothing was working to relieve the pain. Everything was very short term.
Yeah, so let's talk about actually medically. What was her diagnosis? You had a chance to look at her MRI.
We did, Terry, and so what we found is that Julie did have degeneration of her neck, and what that involved was a straightening of the curve a little bit. But this is an MRI that she had done, and it's a side view of her neck, like she's facing to the left. But that red arrow is pointing to that darker spot there as an intervertebral disc. And you can sort of see that's bulging out towards that arrow, and that's a bulging disc, and that's basically pushing in the spinal cord and the nerves, and those were the nerves that went down Julie's arm into her hand, and that was the problem. And I think Julie had gotten adjustments before. That's more for spinal misalignments than these type of disc issues. That's why she didn't really get results with that either.
And she was a candidate then for the DRX 9000.
She was. So something that we offer in our office is called DRX therapy, and it's a medical device that can help regenerate and heal these injured discs. So if they're dried and thin or degenerated, we can rehydrate and thicken those discs up and make them larger, giving space for the nerves. Or in Julie's case, if they're bulging or herniated, pushing in those nerves. With this treatment, we're able to retract those discs in away from the nerves so that, again, they're going to get symptom relief, but it's because we're correcting the cause. We're not just masking those symptoms over and over again.
Yeah, so take me through this. As you started the DRX treatments, exactly what was that process like for you, and how quickly were you able to get relief from the pain?
Absolutely. So Dr. Miller had me on a very strict regime of exercises that I was doing, 2 to 3 adjustments a week just to make sure that I was in correct alignment. And then on the DRX system itself, a half an hour of that intense therapy, and then you would get off heat treatment, cold treatment. I would go home and do an exercise regime. And within like 5 weeks, Terry, I had full feeling back in my hand. My thumb wasn't numb anymore. My range of motion had increased dramatically. So in 5 weeks, after 5 years, 5 weeks didn't feel long at all. And I was at my wit's end. Surgeons had written me off, so it was a blessing to me.
How surprised were you to finally get relief? Did you think before you started this treatment program that this was just how you were going to live the rest of your life?
I did, until I saw the DRX 9000 program on TV. I've been in chiropractic since I was 8 years old. So it was surprising for me that I had even gotten to this point, but with multiple injuries, Dr. Miller had explained, you know, how that had happened, and there was just no way to cure it without something bigger going on. So it was a huge surprise, yes. I'm delighted.
And it sounded like a personalized treatment plan too, because
Yes.
she was sharing those, you know, the different exercises that she did as a follow-up. How would someone like Julie reach out to you, and how does that process begin?
Yeah, well, definitely call our office, or they can go online and schedule that first appointment. But we do have a special for the viewers if they want to get a hold of us and see what we can do to help. For $20.22, we'll do the consultation, and we'll sit down and meet. And often, you know, it's just one-on-one, and I'm going to talk about what they've done before. We'll get to the bottom of their symptoms and how it's affecting their life. And then usually we'll move ahead with a physical examination so we can get a proper diagnosis, Terry. And if we need to take images, we will. If we need to get them in, if they've already had them, we'll do that. But then, you know, I'll review it all and make some decisions. And if they're a candidate that would do great with this, we'll talk to the patient about that. And, you know, like Julie said, it's individual based, so they vary, but it's start to finish. And it's all structured, and, you know, if they go through it, they're going to do well.
How are you feeling now, Julie?
Great.
Wonderful.
It's exciting just to have feeling back and to be able to do things that I haven't done in 5 years. Yeah, it's wonderful. Can't wait to see if I can golf next summer.
Sounds great. Well, thanks so much for stopping by 8 West.
Thanks,
This segment sponsored by Total Health Chiropractic. We'll be right back with more 8 West. Don't go away.